one point. I mean, I'm more used to, if you kind of imagine three groups of patients, so those with a disease, and then we would maybe use treatment as in HALT on oligoprogression. Then you have the patients in whom, as you mentioned, Shobit, low burden of disease, and then you're using radiotherapy perhaps rather than surgery. But this is different. This is heavy burden of metastatic disease and then coming in with consolidative treatment, which is not something we're really doing a lot of, I don't think, as much as the other two groups of patients, as in one the oligoprogression and one with the low volume of disease. So yeah, I agree. I mean, 30%, over a third of patients went on to have surgery, which is something I don't know how we'd be sitting in MDM to persuade our thoracic surgeons with these patients with a heavy burden of metastatic disease and asking them for surgery. And in the conference itself, this was raised that there wasn't a lot of detail, especially, I mean, patients had pleural effusions, for example, and areas that are quite difficult to control, and they were having surgery or radiotherapy. So, and there will be more data coming out, and they will give us more kind of granular data that I think will help us a little bit more. But for the first, just for the beginnings, I think it gives us a lot of food for thought.